the state of most primary healthcare centers in Benue State, with inadequate manpower, equipment and drugs, thereby making the provision of universal health coverage almost impossible. This primary health care center, located close to the urban center, is understaffed, with no medical doctor to attend to emergencies, with patients enduring hard times before accessing medical services elsewhere. This runs contrary to the National Plan on Universal Health Coverage. The Benue State government, however, wants to take up the call to up the ante seriously by bringing together experts and health institution operators to examine the problems and evolve practical solutions. Mr. Salawuddin Sikiru is the zonal coordinator of NHIS, and he speaks on the poor national health subscription.
We have our 4% to 3% coverage nationwide, which is very embarrassing. Even countries that have started NHIS after us, like Ghana, Rwanda, most of them, like Ghana has about 50% universal coverage, Rwanda about 75% coverage. So Kenya also over 50%. They started after the Nigerian National Health Insurance Scheme was launched.
To address the challenges of awareness, citizen skepticism and inadequate financing, experts speak on the sustainable funding approach.
Of course, this will require political and financial commitment from the Benue State government through increasing the proportion of government's annual budget allocation.
The Executive Secretary of Benue State Primary Healthcare Agency says the goal of the Save a Million Lives is wrapped around improving the health indices of the state, including universal health coverage, while the program manager insists that the scheme can be arranged to be relatively harmless financially to all contributors.
In terms of nutrition, malnutrition of children, we are looking at that. We are looking at malaria and the preventable deaths it causes. We are looking at preventing mother-to-child transmission of HIV in pregnant women.
In Lagos State, they tax more rich people to fund the health of the poorer people. It happened in Rwanda. Is what is going on in Ghana. So they can begin to adopt those kind of things.
Through this dialogue, health institution managers in Benue State seem to have a clear roadmap on how to contribute to achieving universal health coverage and move Nigeria up from the present 4% national coverage. Government at different levels appears to be making an effort to improve different aspects of health, sometimes in partnership with those who should know better because they have recorded appreciable results in that area. The National Assembly Health and Appropriation Committee's primary focus in their retreat in Johannesburg, South Africa, was how to improve Nigeria's health sector.
Interprofessional rivalry in the health sector. It goes from primary health facilities, secondary health facilities, and tertiary health facilities.
Build a cottage hospital in every local government.
Yes.
Well equipped.
Yes.
We say about between 30 to 60 beds.
Yes.
Now, in every senatorial zone, have a reference hospital.
Yes.
Well equipped.
That is secondary.
Thank God we are having a summit very soon. And in Nigeria, I think most of these things should be in the forefront.
They not only listened to one another, but also heard the country experiences from their counterparts from Swaziland and Zimbabwe.
Make thousands of laws, but if they are not implemented, you are just doing nothing. If you cannot...
Experts in budget research were also at hand to present their findings regarding budgetary performance, or the lack of it, in Nigeria.
Instead of allocating more money to health in blanket, let us focus on capital expenditures, because that is exactly what translates to what people get. Then quarterly budget releases and implementation report. How can we be deliberating a new budget if we have not seen the report of what has been implemented in the past? The last thing I would recommend is access to the health ministry audit report. A lot of things have been identified. What exactly are we doing concerning those
issues.
Everyone blames implementation for the lack of performance.
Everything begins and falls on leadership.
We have resolved that this 2017 we must enforce its implementation, because once it's law, it's law.
We have at least come to the conclusion that the success of health in any country is a function of dedicated funding and also dedicated personnel.
Hopefully, the resolutions made here will make a difference for the better, in this case, in Nigeria's health sector. Analysts have projected that Nigeria's population of 180 million will increase to about 270 million by 2030. About 54% of this projected population will be in the urban centers. Now, this influx of people will definitely stretch the limited infrastructure, and one area of concern is the environmental implications. This meeting in Kaduna, organized by the Nigeria Infrastructure Advisory Facility, is to examine the key factors militating against effective sanitation and environmental policies.
We still have a long way to go. So the objective of today is to get you, the stakeholders, discussing and dialoguing, us, the international consultants, sharing with you our expertise and our knowledge, and coming out of today what we would like to see is effectively a roadmap for sanitation, waste management, liquid waste management, in terms of where we can hope to get in the next 5 years and what are the course of actions that we need to follow.
The Kaduna State Deputy Governor believes that in moving from the NDGs to the SDGs, priority should be given to the critical aspects of municipal service delivery.
A clean environment says a lot on the quality of life and therefore the level of productivity, in humans.
With Nigeria being a signatory to the United Nations Framework Convention on Climate Change, the belief is that at the end of this workshop, participants will come up with useful suggestions towards improving the quality of sanitation and the environment.